Well, if the hand is beginning to go into ulnar drift, which means that the fingers are actually slanted this way, that is a sure sign that I think Dr. Kaplan mentioned it. You have a joint capsule because these are what we call synovial joints. And there's nothing that you can do to stop the deterioration of the joint. So the first thing that I'm going to say is that you probably are going to want to start thinking about positioning so that you can protect what you have. Typically, that may require a splint like this to be made. And the reason that I say this specifically is because it will position your hand. There are some very nifty splints that are on the market that you can actually, they have like foam that go between the fingers. And you can probably get honestly an order for an evaluate and treat and then to be placed in something like that. And what it does is it starts the positioning. Now, the question was about how do you exercise that? So what happens is the hands, what we call abduct. That means the fingers are spread apart and then they adduct and then they come back together. And what's happening there is there's movement between the fingers and some muscles that start and stop in the hand. So if you start doing this, just kind of bringing the fingers together, and I would say do it on the flat surface of your table. So spread the joints and hold it for 5 seconds and then bring the joints back. And then also look at trying to, again, straighten, because straightening is important because usually what happens is the joint go into this posture. So also bringing the fingers into a straight position and then trying to bend them as far as you can. Again, I would advocate preparing the joint to do the exercise by warming the joints with a tolerable heat. And but other than that, I really think that if they're starting to drift, it's not just the ulnar drift at the MCPs. There's probably some changes also at the wrist. And that's the larger joint that you begin to rely on when you start to see the deterioration at your smaller joints.